For this project, we've chosen the MHRA. The MHRA is the Medicines and Healthcare Products Regulatory Agency in the UK. They regulate medicines, medical devices, and blood components for transfusion in the UK. And they're also responsible for ensuring their safety, quality, and effectiveness. So it's interesting to study the MHRA due to Brexit. And the MHRA previously relied upon the EMA, which is the European Medicines Agency, and it had no ability to undertake different processes and procedures. As a result, it didn't have a strong brand identity, but at the same time, the MHRA is a well-resourced agency. It led the approval for over 35% of EMA approvals. Furthermore, they're currently working on their 5-year strategic plan right now. And some at the MHRA see Brexit as an opportunity to be a global regulator, a world-leading and factor in driving life science investment in the UK. So the MHRA has 3 target customers: pharmaceutical companies, HCPs, which is healthcare professionals, and the general public. For this project, we chose to focus on HCPs. This is because trust in the MHRA as an information source for medicine safety and medicine regulation in the UK is paramount as we move to a post-Brexit era. Secondly, it's key for HCPs to be informed of any reforms or changes in regulations. Also, HCPs need to be the source of information with the public. And lastly, HCPs are showing concern for medicine regulation post-Brexit. So to inform our marketing strategy, we wanted to first look at the customer journey. So we did this using the See, Think, Do, Care framework. We segmented the audience, tried to understand their micro moments and the signals they would give. Then we looked at the future mission and purpose. So the mission for this was to be a credible, reliant, trustworthy, and go-to source of medicine and device safety information, especially post-Brexit. And then we used the why, how, what model to understand the purpose and how to deliver our mission. So our why was that we believe that everyone in the UK should have access to high quality, safe, effective medicines. The how is that we regulate the safety and efficacy of medicines and medical devices specifically in the UK. What? Well, we provide up-to-date, easily accessible information regarding medicines and device safety for HCPs. Then we wanted to look at how can the MHRA brand values link to customer needs. So we took the micro moments we had originally identified, and then we used Aristotle's 7 causes of human action and Maslow's hierarchy of needs to try and see how the MHRA can meet the needs in this moment. So for example, if we take the 3rd micro moment here, I want to know about any key changes in medicine regulations due to Brexit. Well, having applied Maslow's security need, we will create a Brexit FAQ section and a chatbot to ensure that the HCP, that any questions HCPs have that may be about the impact of Brexit are answered and addressed. And then we wanted to develop our marketing plan, our content plan. We use this using the Hero Hub Help framework. As we can see here, for example, for the Hero, we decided to do a film of MHRA experts showing they care and support HCPs, and this will be disseminated across all platforms. Similarly, with the Help, we have decided that it would be a good idea to have an app with digestible FAQ of Brexit changes with push notifications. And this would then lead us to have a balance of customer needs and business needs to operate in the sweet spot. This being customers want up-to-date, accurate information they can trust to give healthcare advice, and well, MHRA is there to give this to them. So then we looked at how can we use social media to engage HCPs. Well, currently the MHRA they have quite a good following on Twitter. However, they've got numerous accounts, and the medicine safety page hasn't been updated since June. And LinkedIn also has a large following, but no content. Then we decided to do a bit of research of our own. We discovered 75% of HCPs use a smartphone, 90% of physicians are social media consumers, and the most common platforms for HCPs to use are Twitter, LinkedIn, and dedicated HCP communities, including Doc2Doc, British Medical Journals, HCP platforms. Then we decided that the best way for the MHRA to use social was to utilize hashtags to tap into ongoing conversations. So using things like Twitter and really getting people engaged with what the MHRA has to say. And secondly, identifying and working with HCP influencers. We would use paid targeting to drive more people to our social media pages and also our website. We'd also reply and engage with our audience. The platforms that we would use would be Twitter, LinkedIn, and YouTube. And then what needs to change in order for this to happen? Well, you need the right structure and capability. You need a chief marketing officer that's focused on HCP experience, but also need to gain some digital marketing talent. Also, you need a customer-centric plan and metrics to measure this to make sure that you are constantly doing the best you can. And last but not least, of course, alignment communication. You need market organizational buy-in. So you need to get everyone in the company to work towards the same goal. Also consult other stakeholders, such as the Department of Healthcare and Social Care, to ensure alignment of the change. And last but not least, you need digital champions to demonstrate the digital first mindset, which, as we know, is incredibly important in a digital era like today. Thank you very much for listening.